This Nursing Leadership and Quality poster presentation will discuss the effects of leadership communication on nursing burnout and the staffing crisis. When looking at a large 2-year study of nearly 1,700 nurses, we see that a majority, 58%, experience burnout while another quarter experience high levels of burnout. One contributor to this is the exposure to patient deaths, which has been correlated to an increase in cynicism, emotional exhaustion, which is addressed in multiple other studies, and a stagnation of reported personal accomplishment. The Joint Commission's own mass study in 2019 showed that nurses don't find that their organizations do a good job of addressing this serious issue. The correlation to financial expenditure is economically crushing, as replacing new nurses and, more importantly, experienced nurses costs the United States hundreds of millions of dollars every year. The question is, could something be changed so that this money could be spent elsewhere? The purpose of this poster is to shine a light on how managers could better support their nurses in order to potentially decrease the turnover rate and avoid burnout. So what organizational and cultural paradigm are we living in that leads to high levels of burnout and turnover? Well, it stems from the ability of leaders to address specific workplace issues. One example being bullying, and that it leads to emotional exhaustion, that term we looked at earlier, which then degrades to job dissatisfaction and eventual turnover intentions within the employees. It is also found that nurse leaders tend to rate themselves higher than their employees do, and that those who do overestimate often were found to be less effective leaders than those who didn't. One hospital found that by surveying departing employees that they were not supported properly in the hiring process, and that they did not have someone to go to for questions and concerns. Knowing what is causing the problem is further made shocking when looking at how poor managerial support of burnt-out nurses affects the patients. Burnout and dissatisfied nurses in one study were found to have significant rates of leaving procedures undone, care plans unfinished, and unable to adequately monitor their own patients. A third of nurses with burnout and a quarter of those reporting job dissatisfaction claim that they were unable to give medications on time. This has monumental repercussions when recognizing how certain drugs are not supposed to interact with each other, and how delaying spacing of doses can be ultimately fatal. This is a serious finding. Burnt out and dissatisfaction of nurses will lead to the inevitable prolongation of patient hospitalization, which ultimately increases the need for additional staffing, leading to a cyclic issue that affects both the nurses and the patients. Since this profession requires us to always be dealing with difficult care situations, avoiding burnout is impossible unless we are supported by authentic leaders. Leaders who analyze the situation in all directions before making important decisions. Leaders who are open with and encourage others about their feelings, thoughts, and ideas. Leaders who self-regulate their own internal moral standards and values, which are exhibited through similar behaviors. And we must be supported by leaders who are self-aware of their own strengths and weaknesses and how they affect others. This authentic leadership is what makes transformational leaders so important. They understand the opportunities for communication. Transformational leaders adjust how they speak with their staff and do so in a way that promotes individuality. They inspire others through staying committed to the organizational goals. What makes these leaders such impactful communicators is the loyalty they give and the trust they have built with their staff. Transformational leaders understand that giving their followers to engage in evidence-based practice raises feelings of personal accomplishment, which avoids burnout. One common principle in leadership is the 80-20 rule. This rule states that 20% of people take 80% of our time, and that as leaders, we want that time to be comprised of healthy interactions and support. Additionally, developed competency frameworks are one way nurse leaders and clinical nurse specialists are being assessed. These frameworks are built around therapeutic communication principles and based in skill of recognizing anxiety and distress among employees as to help fine-tune support communication. And finally, the Downs and Hazen communication satisfaction model identifies how giving personal feedback and recognition Having trusting professional relationships and sharing organizational goals are the strongest predictors of job satisfaction among nurses. So, what can be done to incorporate these communication styles and develop transformational, authentic leaders for our burnt out nurses? In addition to implementing these frameworks, it is suggested by Go and colleagues to incorporate self awareness elements into nursing leadership development programs. Additionally, providing empirical reference on an individual and organizational level ultimately promotes the feeling of job satisfaction and personal accomplishment among burnt out nurses. Nursing burnout and turnover is not something that will go away, as the nature of this profession is emotionally taxing. What we need is invested, authentic, transformational leaders who care about their employees and see them finding satisfaction in the difficult work they do.